I'm Davide Cacchiarelli. I'm Professor of Molecular Biology and Principal Investigator of the Telethon Foundation, a charity working on diagnosing, studying and treating rare genetic disorders in Italy. So we approached the collaboration with MGI in 2020 during the pandemic. Therefore, once the pandemic finished, we thought how we could apply the technology that we optimized of amplicon sequencing to existing needs in the medical field. And we came out with an idea of screening for hereditary breast and ovarian cancer syndromes, checking the full mutational spectrum of 5 genes, which are BRCA1, BRCA2, CHEK2, PALB2 and ATM, which are the top driver genes of not only hereditary breast cancer, but also ovarian, thyroid, pancreas, and prostate. And therefore, providing to the community a screening tool for population genomics and population screening at an affordable cost. So the most critical things when developing an amplicon panel is to identify regions that could be efficiently amplified and sequenced. By reiterating the design of our HBOC amplicon panel, we've been able now to find a very well balanced panel that covers 99% of the coding genes of interest, and most of all, we've been able now to find also an optimized bioinformatic pipeline that can automatically report only the variant of interest based on existing public databases. So in the Telethon Foundation, we're always looking for collaborating with new entities and new companies just to try to find what is the best solution to tackle our daily needs for sequencing. So approaching the DNB-seq technology was an alternative way of better refining some regions of our genome that could be more difficult to sequence with existing technology, or also to make a validation of existing results. So DNB technology as a difference for standard SBS technology provides an orthogonal way also to validate our findings. And now we keep collaborating with them, trying to find new means to explore the genome. In particular, we're trying to work on effective and streamlined ways of analyzing whole genome sequences, trying to get better genomes at a more affordable price so that we can more effectively diagnose the rare genetic disorders. We have started analyzing stomics samples in early mouse development, and especially in what we call artificial embryos, so xenoembryos. And we are using this technology to push the limit to be able to see at the earliest time of this reconstruction of artificial embryo. Sometimes it doesn't exist one technology that fits all needs. So we are using DNB technology as one of the many tools that we have in our toolbox to answer specific questions. Given the unicity in how the DNB-seq technology has been developed, of course, it has its own niche to answer specific questions that cannot be solved by other technology. One of the challenging questions we are trying to answer nowadays, it's not just how our DNA is made, but also our transcriptome is made. In particular, in challenging specimens like FFP samples or liquid biopsy. In our lab, we adapted specific 3' end technologies in combination with DNB sequencing to efficiently monitor the expression of specific tumors or metastases present in liquid biopsy samples that are not affected by the degradation state of the sample itself. One of the biggest challenges for our foundation is not only to diagnose diseases, but also being able to support patients in their journey towards an effective diagnosis. We also want to be able to catch very early carriers of those mutations, and therefore in the next years part of my research would be given to the research of effective carrier strategies to monitor in the general population the carriers of more common rare genetic disorders.